Beth Israel Deaconess engaged all the various stakeholders in deciding how we would accomplish meaningful consent for both push, data going from place to place, sort of replacing the fax machine workflow we have today, but also pull, the idea that you might present to an emergency department and we will gather information with your consent from the outpatient, inpatient, skilled nursing facility, or other places your information might reside. So as a baseline, let's talk about HIPAA, treatment, payment, and operations, and existent workflow and policy. We believe, and the HIT Council, the governance body of health information exchange for the Commonwealth, that novel consent is not needed for the pushing of data from clinician to clinician as part of treatment, payment, and operations. So today at Beth Israel Deaconess, and has been the case since the HIPAA initial regulations were put forward in the late 90s, we have a general consent which describes the kind of care you'll receive at Beth Israel Deaconess, points to our notice of privacy practices, and does enumerate that we as part of treatment, payment, and operations may do such things as send information back to your primary caregiver like a discharge summary. And you sign that consent, but it does not specifically offer a description of the HIway. It does not specifically include educational materials about this idea of a relationship locator service. It's purely for recapitulation of the fax workflow, the manual workflows for point-to-point data exchange that we've had for 20-some years. Now, the manual workflow for the release of data, such as a plaintiff attorney, a government entity, or say a treating physician who requests a record, well, this of course does require a special form, and has for 20+ years, a signed consent or medical record release form. Now, there are ways to make that electronic. An example for you is Social Security Administration some years ago felt that there would be ways to automate the release of information for patients who apply for SSI, for special disability payments. It used to be that a paper-based process would result in a 6-month lag between your requesting disability evaluation and the records arriving at the Social Security Administration and being evaluated. Social Security Administration decided that, well, how about this? We will have an electronic form. The patients will sign an electronic form, and that electronic form with some metadata in XML will be delivered to a hospital. The hospital will then evaluate that electronic data and send back within seconds a complete electronic health record if the consent is appropriate. So these are the existent processes. In effect, signing a general consent, a medical records release is signed, faxed, or an electronic version of that as the Social Security Administration has made available. So for our 2 phases of the HIway, phase 1 being something we did in 2012, this push idea of pushing discharge summaries or PCP specialist referral, this sort of thing, we simply said we are going to get rid of the fax machines. We're going to do point-to-point exchange using the mass HIway to push XML formatted clinical summaries per meaningful use, and this is following the stage 1 and the stage 2 meaningful use standards. Initially the CCD, or continuity of care document, and then the CCDA, using the direct protocol from place to place. And of course, our consent describes our organized healthcare arrangement, our affiliates, and various third parties. And our HIPAA considerations are that we push for treatment, payment, and operations if the general consent is signed to various recipients who are directly involved in the treatment, payment, and operations. We would not push to a third party. The data would never go to a pharmaceutical firm or to a registry for clinical trials without your consent or anything of that nature. I mean, it's truly simply replacing the fax machine, using the HIway to push payloads from place to place, in effect, leveraging existent workflows we had for consent. But as my colleague and partners described, the idea of someone not in your organized healthcare arrangement, someone in an emergency department across the country. I mean, all kinds of use cases you can imagine for pull is a totally novel workflow. And there are many stakeholders here. So we have the patients who have their own privacy preferences. We have the providers. We have payers. We have third parties providing value-added services, analytics, or quality measurement, or reporting to the government. So we assembled, like partners, a multidisciplinary work group that included IT, health information management, legal, compliance, and interestingly, patients and families. And we had initially conceived a form that was, how would I describe this, Sean? 3 pages of 4-point type with a place to sign at the bottom. And the patients and families said that is not very patient-centric. It may be legal, but how do we really, as patients, when we're in pain, or it's Sunday at 3 in the morning and we're in an emergency department, how do we understand what it is we're signing or what it is we're consenting to? That doesn't really, I mean, it may be legal, but it doesn't produce a meaningful consent. And so, although we wanted to adhere to HIPAA, the HIPAA Omnibus Rule, and Massachusetts laws like Chapter 305 and 224, almost more importantly than that, we wanted to pass the Boston Globe test. If a patient and family member brought a consent in 4-point type to the Boston Globe, how would the Boston Globe react? So our Patient and Family Engagement Council said, what we need you to do is separate out this HIway idea and then surround it by a very visible box, and don't just sign here, you've consented and that's opt-in. Actually offer a meaningful choice. You will be signing here for the mass HIway if you want it. The educational materials describe its risks and benefits. Do you want it? Yes. Do you not want it? No. Your choice, and regardless of the choice you make, your care at Beth Israel Deaconess will not differ. You have total freedom of choice. Now, as a doctor, of course, I would feel that if doctors have more information about you, like your comprehensive medication list or problem list or latest labs, they can probably deliver safer, higher quality care. But you can imagine patients having very different privacy preferences. And Sean, I'll use a silly example, which is it's not true, but it illustrates the point. Being a CIO is very difficult, very stressful, so I needed a month-long vacation at a psychiatric facility. I needed a few weeks at a detox facility. Oh, did I mention domestic violence, sexually transmitted disease, and HIV? Well, I've just enumerated, 5 things that aren't true, but a patient you can imagine who has any of such visits or conditions might have different privacy preferences as to what data is released. So you can imagine a patient saying, yes, I opt into the HIway's relationship locator service for my treatment at Beth Israel Deaconess, which includes a flu shot, a colonoscopy, and an eye exam. But actually, no, I do not opt in for the sharing of information from McLean Hospital, a psychiatric facility, the Betty Ford Clinic, the Fenway Community Health Center HIV Clinic, etc. So when the patients and families heard that our form would give positive choice separate from the rest of the consent and give them the assurance that care would be delivered regardless of their choice, that seemed to both pass the Patient and Family Engagement Test and the Boston Globe Test. And the Patient and Family Engagement Council asked for one more thing, which is if it's Sunday at 3 in the morning and you say, boy, I am in pain, I have a lot of complicated medical problems, I really want this HIway thing because I believe it's going to result in safer, higher quality care. But then you recover and a week later you say, oh boy, I actually would rather not have information about me shared. You can withdraw consent at any time and reverse decisions you have made. And so we came up with a second form separate from this opt-in consent that enables the patient to change their mind at any time. And so just to show you what this form looks like, There we go. So there is the general agreement, but then you can see the text box, which notes, I have received educational materials about the Mass HIway, and I acknowledge I have. I will allow the HIway to hold my demographic information, the relationship locator service. Yes, no, my choice, and then you can see I sign, and then I also describe that I've received notice of privacy practices, etc. So this is now implemented in a number of our registration areas. Like my colleague from Partners, we had concerns about added workflow or added stress. And actually what we found in our 4 pilot areas is, since already at Beth Israel Deaconess they are achieving general consent at each encounter registration, that this did not actually impact their workflow significantly. They do hand out educational materials. There was some training so that if questions are asked by the patients and families about the HIway, that they can answer those questions or at least point the patients to others if they cannot. And we mark in our registration system the answers that you have enumerated on this form, and if you answer affirmatively, share demographics, then we send your demographics to the HIway for a relationship locator entry in the HIway. If you answer no, we send your demographics specifically with a no, and then what happens is the state matches existent records and deletes everything. So it's important for people to know the second you opt out, every bit of history of your having opted in any time in the past is redacted, removed, and deleted. So there is in fact nothing in the database that would ever associate you with an institution for which you had opted out. And you can understand, in this world of Home Depot databases getting hacked or iCloud being accessed inappropriately, retaining data for which you had said, I don't want people to know, is very risky. So the state simply deletes all data about you when an opt-out occurs.